particular time of the month and you're like, look, salaries have to go out. Let's see how much has come in, how much is going out. I sympathize. I empathize with you, not even sympathize with you. I'm hoping that when the monies go out, you still have a little bit, to stay.
Yes, thank you.
All right. Dr. Viola is the MD CEO of ROA Specialist Hospital, and we are going to be talking about male infertility myths or facts. Today, you can stream live from any part of the world you're at www.wfm917.com to listen, to weigh in on the conversation. Okay, let us get into it. Doctor, when we talk about infertility, many people always assume, there's no is or maybe assume, they always assume that it's the woman's issue. Could you help us understand what infertility, beg your pardon, is?
Yeah, I see a lot of infertility cases, and most of the time, the first visit is attended by the woman only. I'd say that's 9 times out of 10.
Mm-hmm.
I personally will not take an infertility case if the man is not involved. It's fine if she wants to come first, but sometimes I'll have her call her partner on the phone and say, "Look, I need you to be part of this too. If not, I'm going to reject the case."
Mm-hmm.
And the reason for that will be in the answer. You asked about male infertility, and the infertility is the inability for a couple to achieve pregnancy after a year of regular unprotected intercourse. And regular means typically 2 to 3 times a week. So male infertility specifically refers to the man's inability to impregnate his female partner. And about 1 in every 7 couples worldwide struggle with infertility. And
Mm-hmm.
about 40% of the time is the man, another 40% of the time is the woman, and the remaining 20% of the time both have a part to play. So it's equal. If you want to compare men and women, it's exactly equal. There was a study done in Louth that showed that male factor infertility accounts for about 50% of infertility cases. So also same thing was seen in Nigeria.
Hmm. Okay, let's keep it moving. How common is male infertility? Just to write on that. And what percentage of infertility cases are male related in Nigeria? Because if you ask anybody, they can tell you off the top of their head the percentage for women, but what are the percentage for men in Nigeria or even globally?
So the percentage for men is almost exactly the same as the percentage for women in Nigeria, 40 to 50%.
Mm-hmm.
And worldwide, about 80 million people suffer from infertility. So up to 12% of couples will have infertility. So it's very common. Um, in sub-Saharan Africa, where we are, it's even more common. It's 1 in every 5 um, have struggle with infertility. So it's this is a topic that involves many people. It'd be difficult for you not to have known somebody that struggles with infertility, whether they
Mm-hmm.
tell you or not.
Mm-hmm. Absolutely. Okay. So what are some of the main causes or most common causes of male infertility that you have encountered in your own practice?
Yeah, here, at ROA, I keep statistics. So the some of the leading cause is oligospermia, which is low sperm count.
Mm-hmm.
That affects about a third of men. Then almost a third is poor sperm motility, meaning the
Mm-hmm.
sperm don't move very well. Um, about 15% is abnormal shape of the sperm. So when we're
Mm-hmm.
looking at sperm, we look at how fast they move, and how they move. We look at their shape, and we look at the absolute number, the count, the sperm count.
Mm-hmm.
All three of those go into when you do a sperm test or a semen analysis. And then
Mm-hmm.
in about another 15% of them, I'll see something called a varicocele, or it's a dilated vein in the scrotum, which
Mm-hmm.
can increase the scrotal temperature and can end up increase the testicular temperature and can end up killing sperm before their time. So as opposed to women where you see a lot of hormonal imbalances and things like that, typically this is what we see in men: low sperm count, poor movement, bad shape, and the varicoceles.
Hmm. Okay. Is male infertility usually permanent, or are there cases where, they can be treated or they can be reversed?
Yeah, that's a good question. About 7 out of 10 or 70% of men with infertility have treatable causes.
Mm-hmm.
When I talked about the dilated veins, there's a surgery we can do to cut them out, and that helps about 80% of people that receive that surgery. At times, man can have an infection, so
Mm-hmm.
treating the infection restores fertility in about half of the people that you treat.
Mm-hmm.
And then I do see men with hormonal issues, maybe low testosterone or things like that, and whether it's giving them hormone or adjusting lifestyle, you could usually normalize or improve sperm counts within 3 to 6 months.
Mm-hmm.
As we'll talk about some of the other factors or risk factors, but an example of one lifestyle thing is, for example, if the person smokes, smoking directly affects sperm quality. So if I
Okay.
can get them to stop smoking or get them to stop using excessive amounts of alcohol, you can sometimes that alone is enough to improve the sperm quality.
Okay. Let's just get into a myth. Is it a myth? I don't even know. One common belief is that if a man can perform sexually, then he cannot be infertile. True or false?
So that is false. I
Okay.
can see how men would follow that myth. You can have excellent sexual function,
Mhm.
normal erections. You can be a champ in the bed, but then still have a low sperm count.
Hello.
you know, or no, or sometimes there's something called azospermia, which is no sperm count. So
Mhm.
semen comes out, but there's zero sperm in there. So when you're looking at sexual performance, that's blood flow and nerve function, and those can be working. Then when we talk about sperm quality, that those have different factors,
Mm.
that involved. So that is a definite myth.
Okay. But then there's some men who believe that just because they had children in the past, we see this time and time again. Oh, but I got someone pregnant. Okay, where is the child? Okay, she had an abortion. Or then you have the ones that say, oh yeah, but I have a child from a past relationship, and we're just finding out now, but that's not even why we're here. But
Hmm.
like I had a child maybe over 10 years ago. So they believe that because of that experience, then it means that they can never be infertile again. True or false?
So that is definitely false. There are
Okay.
two main factors. One, things can change.
Mm-hmm.
You were not born with high blood pressure, but by the time you're 50, you may have high blood pressure. Just
Mm-hmm.
because I wasn't born with it doesn't mean I'm never going to get it. And then two, that child that you said you had in college that was aborted or something, are you sure that was your child? I've seen it. I've seen it. I've seen it
Doctor, we are like,
before.
you're coming for violence this morning.
I'm
What's
telling you,
going
I've seen it.
on? But yes,
Well,
I agree with you.
I've
Yes.
I've I've seen it more than once. So
Mm-hmm.
it's good to just do your baseline tests anytime you feel like you're having difficulty, whether you think it's your fault or your male factor or female factor. Just do your tests.
Yeah. Okay. Finally, I think maybe if I think of another one is there's this myth that really that that real men don't have fertility issues. And the thing about this is because every man who says, oh, I'm a real man, I'm a big man, it does affect their willingness to seek help. Can you unpack that for us?
Yeah, that's a problem with ego. When and for want of a better word, cockiness.
Mhm.
Money, the amount of money you have doesn't, or success you have in life has nothing to do with fertility. So it can, and oftentimes you see worse cases in so-called rich because they have other um, rich related diseases. For
Yeah,
example,
like, yeah.
obesity, diabetes, high blood pressure, stress. All of those things can negatively impact your fertility. So the best thing about being affluent or having money is that if you have infertility, you can pay for all your tests. But
Mhm.
it does not mean that you don't have anything to look at.
Okay, one final one is that the myth that wearing tight, I have actually heard this before, wearing tight boxers or sitting for long hours can cause infertility. True or false?
Can definitely, that's a true one. It's
Oh,
it's
I didn't see that
it
one
can.
coming.
Yes, it can.
Okay.
Because I talked about varicocele, which is the dilated vein in the
Mm-hmm.
scrotum. The reason in the surrounding the testicle. The reason why that is a problem is it raises the temperature of the testicle, which can kill sperm. So your
Okay.
testicle wants to be your testicles work better 1 to 2 degrees Celsius below your body temperature. That's
Okay.
why the scrotum hangs away from the body, is so that
Okay.
it's not being warmed up. So if you
Okay.
sit for a long time, or you wear tight underwear, or you're a long distance driver, or you use a laptop on your lap all the time,
Mm,
all of these can raise scrotal temperature. And 25% of the time in chronic cases, you can tie it to one of these factors. So it's an
oh
important
wow.
thing to look at. Bankers, drivers, IT workers, that's why I always ask people, patients, what do you do? What I always ask that. I always write it in the top left corner, or I type it into the computer. It's important for many different conditions to know, what does that person do every day, all day.
Right. Okay. Okay. Right. Let's get into some other things. You
I
mentioned
like I like the
smoking.
myths. I like it. So they're
Yes,
they're
no, because
interesting.
and I'm glad that you're the one who's saying it. I'm even glad it's not a female doctor speaking on it, because men just have like this. They're just typically averse to a woman giving them facts, regardless of what position she holds, whether she's a medical doctor, whether she's a doctor of that field, having
Mhm.
a PhD or whatever. Men are just averse to it. So I'm glad that you're the one who's you know shutting down these myths. I'm very, very happy. Okay.
Fantastic.
You had mentioned smoking earlier on. So, what other lifestyle choices can really impact a man's fertility levels?
Yeah. One of them, alcohol.
Okay.
So excessive use of alcohol, which is more than 3 drinks a week,
Oh,
is yeah, yeah. A lot of people think they can drink a lot more than that, but some people can drink more and get away with it, and some can't. So they always say, don't lie to your doctor, your pastor. Who's the other one? Your lawyer, right?
even if you lie to your doctor, should be the results to show it.
Exactly. So I also always ask about that. Alcohol reduces your testosterone levels and your sperm production. So heavy drinkers will usually have about 40% lower sperm counts. It's a real issue. After
All
that,
right.
smoking is the next one. We talked about it a little bit. It
Mm-hmm.
damages the DNA in the sperm, and it risks increases your risk of infertility by about times two.
Okay.
Another one we touched on a little bit was obesity. So when you have a body mass index close to 30, 50% lower sperm production is almost than normal weight men. It's also quite significant. And one that people don't consider much or often is stress. So stress, if you're constantly stressed, there's a hormone that's produced or secreted called cortisol, the stress hormone,
Mm.
and that suppresses testosterone production, lowers the motility of sperm. So I take all of this into account when I'm dealing with male factor, or
Okay.
even in female factor. But when I'm dealing with male factor infertility, I make sure I talk or touch on these four, because these are reversible.
Yeah. Okay.
You can reverse smoking, you can reverse alcohol, you can reverse obesity, and you can improve. If I can't take away the stressful job, which I never suggest, I just teach you how to manage stress better. So
Okay.
managing stress is, I can't take away your commute. I can't take away your job or your boss, but I can help you manage the stress better. And I do include that in my treatment routines.
Okay. All right. So we've talked about alcohol, smoking, and stress impacting men's fertility levels. But what are these tests? What tests or evaluations can be done to diagnose male infertility?
So the main one is a semen analysis.
Okay.
So typically it's combined with a culture. So we're looking for infection. The look under the microscope for those motility, house, the speed, the normal shapes, all of that, and they're all represented in percentages on the report. The important thing to know is that you cannot, typically I will never allow a patient to generate the sample at home and bring it in. By that time,
Right.
it needs to be analyzed within 10 minutes of leaving
Okay.
the body for all optimum results. So usually it's generated in the lab here. We lock you in a ward room, and then you can now come. um, and submit the sample. But the sooner you look at it, the better the results are.
Okay.
Then after that, I'm going to do a hormonal profile, especially if I have any abnormal semen analysis. Then I'm going to do a hormonal profile for the men, looking at things like testosterone, FSH, LH. All of these things tie into sperm production. And on that same day, we'll probably do a scrotal ultrasound, which is a scan of the scrotum, looking for those blood vessels, those dilated blood vessels, and anything else. Sometimes you see testicles that are smaller than normal. You can see decreased blood flow.
Mm-hmm.
All of those kind of things you can see on the scan. Rarely will I now do a genetic test. Looking at the DNA. It's rare because they're quite difficult and they're usually quite expensive. But by the time we do the first three, semen analysis, hormone profile, and the ultrasound, you can identify almost all the causes.
Okay. Okay. Still speaking on that, in what ways can male infertility be treated or managed? Because of course, if the person has come to the hospital, they've done the test, and it says, bros, your sperm isn't quality like that. I don't know what term you use for it. What ways, I'm sure that they would want to ask, okay, can this be treated? So what ways can male infertility be treated or managed effectively today? So those are like two questions, because there's one, how can it be treated? How can it be managed?
Yeah. One of the first things I'll say to them when they ask that is treatment. Number one, treatment depends on the cause. So
Okay.
we have to identify the cause.
Mm-hmm.
And two, this is not an overnight fix.
Mm-hmm.
So
Okay.
for you to have sperm turnover in your body, meaning new sperm, all the new sperm to be produced, it takes 3 to 4 months. So
Okay.
any treatment that you're doing, you need to carry it out for at least the same 3 to 4 months. It's not a
Okay.
1 month thing. It's not a 2 month thing, and it's rarely even just a 3 months thing. That it's things that you need to carry on. When we talk about different causes, if it's an infection, we can give antibiotics. 50% of the time, it's enough to restore, good numbers. There's a surgery for those blood vessels that are too loud. Sorry, too large, and about 80% of the time, that's successful. And I'm giving my numbers here, but
Okay.
they're pretty comparable to what you see in the textbook. And then treatment, where hormonal treatment, where we're trying to improve testosterone or things like FSH, we can do that with medications. It's important to know if you have low testosterone and you're working on infertility and somebody starts injecting you with testosterone, you've just made the problem worse.
Huh.
And I've seen it all the time with unqualified doctors or doctors that don't understand, or they'll say chemist or a nurse or somebody that just doesn't have understanding of how the body works. Will just see low sperm count. They say, "Oh, I can buy testosterone," and just give the patient testosterone, and you're just going to make things worse. So
Oof.
there's ways of improving testosterone for these cases that you don't involve actually giving testosterone, and those are more important.
Hmm. Speaking of low sperm count, is it a form of infertility or it's like on the road to infertility?
No, it's a cause of infertility. So
Okay.
it's a definite cause of infertility.
Okay.
Um, for some of these, we've been doing now something called IUI here in the hospital. It's called intrauterine insemination, and it's good for things like low sperm count, where they'll generate the sperm, the semen in the hospital. We prepare it in the lab, and then in the theater, I will now inject it straight into the uterus, right, through the cervix. And I typically sometimes I do it twice. So I'll do it one day and then I'll do it the next day just to increase success rates. It's about 20% successful per cycle, which is pretty good, 1 in 5. So by the time you do it 5 times, you should have had success. And because it's not expensive, IVF is it can be a 5 million naira to do
Mm-hmm.
one cycle of IVF, and it gives you about 35% success rate. But
Okay.
IUI could be less than 20% of that cost, and so
Okay.
you know that none of these things are 100% successful on the first cycle. You need to be prepared to
Hmm.
do multiple cycles. So if you can
Hmm.
afford to do 5 million naira IVF three, four, five times, then fantastic. But if you can't, then things like IUI or things like ICSI, which is um, similar, but I don't want to get too technical. But all those things are on the way to IVF, and they give you the success you need.
Hmm. I mean, just finding out the cost of, IVF or even IUI. Some people are just like, because I want to have a child, is quite crazy. Anyway, how important is early medical consultation when couples are struggling to conceive? I ask this question because, for the most part, women, like you already said, women are the ones that go. But if they don't go with their partner, then it's like half of the units is missing. So you can't really, whatever is happening can really be effective. For some people, they might say, "Oh yeah, my husband's not around; you can still work." But how important is early medical consultation for them when they're struggling to conceive? Is it from the first 6 months? Because you doctors will typically say if you've been trying to have a baby, it means that you have been at it for like is it 6 months to a year before you now say, "Do you know what? It looks like we have a problem." So, but then how important? So I'm going back to my question: how important is it for couples to actually pay attention, to what they're doing, to be able to say, "Oh, hands up, I need help."
Yeah, the technical definition is 1 year of
Okay.
trying, right?
Okay.
And that's what I learned in the US and the textbooks and in school.
Okay.
But the cultural pressures of having a child are different
Hey.
in Nigeria than they are in the States.
Yes.
So I will now seriously look at a couple 6 months in.
Okay.
So 6 months of trying, I'll now start, the evaluation process. And I sometimes I have people that come 6 months after, and they say, "Oh, my husband doesn't live in the country." So I said, "What? How many times have you guys met in the last 6 months?" And she said,
Mhm.
"Twice." I said, well, then that's you guys got to
Chances
look at that.
are,
Yeah, chances are it's called inadequate exposure. So you're not exposed enough to really have a legitimate chance of. So I said, when those conditions change, then come back. Otherwise, you're just wasting time and effort. But
mhm.
by the first, typically the first visit is the woman, and I give them a roadmap, so they leave with a reminder sheet. It's like a long sheet, and I've ticked different things. So this is when you come for your first blood test. This is when you come for your second blood test. You're gonna test for ovulation on these days. I'm gonna check for your tubes to be open on this date. All the different things, and it usually takes a month, like a full cycle, to get all those tests done.
Mhm.
So by the time we were reviewing those tests, I would want to see both of them, so that I'm looking at the husband's sperm, I'm looking at the wife's month-long testing, and then I can now counsel both of them together.
Okay.
After that, if it's male factor, I usually consult with them every 2 to 3 months just to make sure things are going well.
Okay. You mentioned 2 questions ago IUI. Is IUI invasive or it's invasive, Abby?
Um, we call it minimally invasive. So it's just a very thin. All that really gets done is a speculum, a speculum in the vagina so that I can see the cervix. And then I use a very thin and long cannula. It's just a plastic tube to go through the cervix. If the cervix is not open, I'll use an instrument to open it.
Okay.
But usually that plastic tube is so small it can get in. And then I now just push, almost like an injection, but there's no needle. So it's just pushing the fluid, and it's about half a mil, 0.5 mils, less than 1 millimeter, 1 milliliter, at the most 1 milliliter that goes in. And after that, I tilt. We do it in the theater on the surgical bed, so I'll tilt her head down so that everything rolls in, doesn't roll out, and then leave her like that for about 15 minutes, 15 to 20 minutes, and then we're good. Important to note that if you're doing IUI, especially if you're doing what I call double IUI, you don't have sex 2 to 3 days before the procedure because you want
Mhm.
the man's sperm to have built up. And in between the sessions, you don't want to have sex either because you will decrease the sperm. The last couple I was working with, they were having sex around the clock, thinking that it was going to improve their situation, and it actually made things worse.
Oh, I mean, like you rightly said, there are cultural pressures right off the bat from when you get married. You see that prayer, that blasted prayer, in 9 months' time, has caused so much damage to couples who probably weren't thinking about having a baby. There's so much pressure. Oh, why are we not having? Oh, why is she not pregnant yet? Family members are coming to visit. Oh, why is she not pregnant? Oh, why is she not? Oh, why is she not? Why is she not? And
Mhm.
people just learn to mind their business. When the couple is ready to have babies, then they can go ahead and do it without the external pressure. Because even as a couple, you're already pressuring yourself. How much more the pressure that now comes from, external places.
Yeah,
Ex-
we mentioned stress and the cortisol hormone. That's a form of stress.
Absolutely,
So it's just going to make things worse.
absolutely.
So I try not to get involved in family, but I will advise the couple that they should manage the stress response for the good of
Yeah,
of what we're trying to achieve, and just don't let it get to you.
absolutely. So, are there simple, non-invasive options that couples can explore before now considering assisted reproductive techniques?
Yeah. So for the listeners, assisted reproductive techniques are things like ICSI, IUI. We've talked about, and IVF. Those are the common ones. But I probably do that in about 10, less than 10% of my infertility cases. Usually we're treating, I have some patients that have given testimonials on our social media that I treated with just diet. Some women that have PCOS, because the foundation of PCOS is something called insulin resistance. So
Yeah.
I'll target that insulin resistance with dietary changes. And I have a lady that has twins now from modifying her diet, and she wasn't big. So it's not about being fat. It's not about. I mean, obesity makes it worse, but she wasn't fat. She's small. It was just how and what she was eating was not conducive. So
Mm.
anything from diet and lifestyle changes to medication. So there's different medication you can give to help ovulation if the woman's not ovulating. Sometimes some women have a hormone that's too high, so we have to give medication to bring it down. Sometimes the man, we're talking about male infertility, has low sperm count or poor motility. We treat that with somebody treat it with just supplements. Now I may have 14 different supplements, including zinc and all these different things, but just supplements, not drugs, are possible. So one caveat or one thing I'll say is that do not take somebody else's remedy for infertility,
Mm.
especially women. Like there's some drugs out there that a lot of women know the name of this drug. You go to the chemist, I'm trying to get pregnant. Oh yeah, just take this drug that starts with a C. And that those drugs can cause something called ovarian hyperstimulation syndrome or
Mm.
OHSS. And if you have an ovarian cyst, or you are prone to cysts, you can develop a large cyst. If a large cyst ruptures, you're now bleeding internally and you need emergency surgery. Half of those
Mm.
women die before they get the surgery they need. So
Mm.
it's you're playing with your life.
Mm.
Just taking I can never give a woman a medication to improve ovulation without have scanned her at multiple times to make sure
Mm.
that if I have cysts, I'm documenting them and I'm tracking them. And I may scan her a couple times in a month, up to 5 times in a month, just to keep track of cysts because I never want them to rupture. So you have to be careful. Just go to your doctor and make sure that they're following a proper treatment plan.
Hmm. I'm particularly wary of drugs. Any kind of, whether I was given at the hospital, I typically do not like taking drugs. How much more somebody, you cannot even convince me to take drugs for something. Like if it wasn't the doctor who gave it to me, because even the doctor that gave me the drug, I know the stress it takes me to be able to take my drugs when I'm healed from with the right prescription. How much more? Oh, take this. No, could never happen. Could never.
For somebody like you, if I have a patient like you that will admit that they don't like using drugs, this is why I studied something called integrative medicine. So, integrative medicine, in the summary, is like using diet, nutrition, lifestyle, and supplements to
Okay.
address problems. Right. So, if you have a blood pressure of 240 over 120, okay, there's no supplement that's going to bring that down before soon enough before you have a stroke or a heart attack. So sometimes medication is
Yes.
necessary.
I
But
mean,
if
in that
we're
case, I will take drugs, to be honest.
good, good, because you won't have the opportunity to take drugs if you leave it that long.
Yeah.
But there's a lot of things that, there's a drug out there for weight loss. I've had women call me about it, and that, the injectable for weight loss. And I'm like,
Is it the one that starts with the O?
yes, it's the one
Oh,
that
okay.
starts with an O.
Okay.
And, I have it in the pharmacy, but it's meant for, there's certain conditions that I will use it. And I won't use it unless the person has really tried diet and lifestyle,
Mm-hmm.
nutrition and lifestyle changes. And you have
Mm-hmm.
to try it you can lose up to 2 kilograms, up to 2 kg a week if you follow a proper dietary plan. So if you're 40 kg over weight in 20 weeks, that's 5 months. We can get you down to your ideal weight.
Oh, Dr. Bill, you're talking
Now,
to
2 kg, two
me.
kg is a lot. I usually tell people to aim for half to 1 kg a week, but I've seen those cases many times.
You're speaking to me. No, so when I'm serious, if I tell myself I want to lose 2 kg this week, I know what to do. And I'm not even, it's partly depriving myself, or maybe I'm just eating more of fruits and vegetables. So I'm not eating, yes, I am depriving myself. I'm not eating any form of carbs. I lost I think I lost 3 kg ish, 3.5 kg about 2 weeks ago. And that's because I did not eat any form of carbs. All I was eating was vegetable soup and moi moi. Break,
Hmm.
not even for break. I was doing intermittent fasting, so I know that that works for me. But the problem with that is sustainability, because I also, my mind is telling me you're doing this because you want to do something. You want to lose 2 kg because maybe you want to lose 2 kg to be able to get into a dress or something, which was what I was trying to do because I had a party to go to, and
Hmm.
I needed my stomach to be snatched all the way flat, right? But by the time I got back from the trip, boy, I've been eating. But here's the funny thing. I realized that when I'm not paying so much attention and it's not drastic, I'm actually losing weight. So if I'm just paying attention to, you know what, you can have your breakfast, is fine, but make sure that you're having breakfast that's little and it's healthy. And then my dinner for the last maybe 5 days, I've just been having dinner by 4 or 5 o'clock at the very most.
Hmm.
And I realized that I got on the scale this morning. I was like, ooh, okay. But now I'm thinking that that was a bad thing to do, because every time I go on the scale and I say I've dropped a bit of kg, I celebrate.
And celebrate means what? Eat anything you like?
Yes.
Oh my goodness. So there's some people like I tell people about myself all the time. I lost 40 kg over the course of about a year. That was what began my nutrition, my
Hmm.
my my deep dive into nutrition. And I coach nutrition now. It's something I talk about with almost every patient. But there some people like me, I ate this out of a week of 7 days. I could eat the same meal 5 of those days. I made this soup with vegetables and meat, and I would eat that soup with tiny variations. I ate that for months, but I can do that. Most people cannot.
No.
So when I do a nutritional consult now, I'll give them anywhere from a 7 to a 30 day meal plan with 3 meals a day, so that they can see that it can be varied and still follow along.
Okay.
But if you want to set up a new habit, right? You want to turn it into a lifestyle choice. You have to do it for at least 21 consecutive days for your brain chemistry to change. So every time you take that break, because you took after 1 week, you got on the scale and you said, okay, cheat day, then hot girl summer, then you now go backwards by
Yeah.
1 week. You got to do it for at least 3 weeks, to make a little change in your brain chemistry, and then it makes it much easier to follow along and consider it a lifestyle. So within lifestyles, we don't have cheat days.
Yeah.
Husband and wife doesn't say, "Hey, once a week you can cheat on me." That's fine. That's
That's an interesting analogy.
we don't have cheat days in marriage, so
We
you
don't
need
know. We
to
don't. I
you need
never
to
saw it
just
that
make it
way.
a
I
lifestyle.
really never saw it that way. Okay, okay. Let's get back to the topic. Enough of diets and all of that. Okay, for men who, there's always this, and you just sort of touched on it earlier, the ego. For men, you're conditioned to think a certain way, to believe that you're a certain way. Your ego is even tied to whether you can perform or not, or how many children you can birth, so to speak. How can men cope with the emotional pressure or the psychological pressure that comes with an infertility diagnosis? You get into the hospital and they say, "Sir, sorry to tell you, but you're infertile." I think I haven't been in a situation where, I mean, men don't come out to say that's what is going on with them, but I would imagine, based off of how men are built, right, that would take the wind off of them right there and then. There's the denial, there's confrontation, like there's the anger as well. So how can men cope? And I'm sure that you've seen this over and over and over again. So how are men able to cope with the pressure emotionally and psychologically when faced with an infertility diagnosis?
The problem is that men often suffer silently, feeling they
Mm-hmm.
have to be strong.
Yeah,
And especially in our patriarchal society,
yeah.
it's more like that. So and infertility or the emotional stress of infertility can cause real problems like depression.
Mm-hmm.
15 to 20% of men with infertility will have depression, and 25% of men will have anxiety. So and all of those things feed into making the infertility worse, and
Mm-hmm.
everything's worse. So some of the easiest ways of treating that is just open communication.
Okay.
So that's why a lot of times if I notice that, I'll bring both partners in and just try to get them to start open communication, whether the man is self-conscious about erectile dysfunction or self-conscious about infertility. I'll just crack a joke and have them say something just open. Like, there's things that your partner can do to improve this, and there's things that you can do to improve that. And then once they can start talking about it, between the two of them, things definitely improve. um, I'll also give them stress techniques. I've walked some people through the benefits of meditation
Okay.
and breathing techniques. It just depends on how I'm perceiving the person and how interested they are.
Okay. You just mentioned erectile disorder. Is it disorder? Dysfunction.
Dysfunction.
Is that different to infertility? It is, right?
Yeah, they're both male. You got male infertility and erectile dysfunction. Erectile dysfunction can be a cause of infertility. So if you're not unable to achieve an erection, then it's going to be difficult for you to meet with your partner. So
Yeah.
I will always ask that question in an infertility case. Sometimes, if your performance is not up to par, it can affect your partner's libido. Your partner may not be interested in sex if it knows it's only going to last for 30 seconds. So
Hmm.
I'll address that as well, because you want to have willing partners. You want to have partners that speak openly between themselves. That's the best way to solve a problem if both people are invested.
Okay. You earlier spoke about, what the partner can do. I really don't want to ask about how partners should support, what role they should play. Because when a woman is going through infertility, we see these things. But
Mhm.
just because I'm nice, and because not because I'm nice, no, no, I'm because I've seen this happen even with friends, even with family members. You hear the stories where the woman is the one going through infertility and there is no support from her partner, but just so that a woman who's like, you know what, I'm going to try to support my partner. How can, beyond going to the hospital with them, what other role should the partners play in supporting their men going through fertility challenges?
Look, supportive partners make a measurable difference.
True.
So if I have couples that attend appointments together and are both invested, they have higher success rates by 33%. So a
Mm.
third of them will do better than those that do not attend appointments together. It's because communication improves. Also, compliance improves.
Okay.
If you're, I have husbands that will, when I'm looking at the woman, I say, "Oh, when was your last menstrual period?" He will say February 6th.
Ah.
And I said, "Okay." How long did it last? About four, and he will say about 4 or 5 days, right? He When I see that, oh, this we can
Shout out
do
to that man.
anything.
Hey.
Yeah, we can do anything together because can remind her about her medication. She can
Yeah.
remind him about his supplements. They're
Yeah.
encouraging each other. Usually, the stress response is less, compliance is better. So if I can see that they're both invested, it's going to be better. I've seen some where the man is. I look at body language a lot. I like to watch videos where they analyze body language,
Yeah.
and if I see the man leaning away from his partner, I know there's a problem.
Ah.
I look at the midline, so I look through the nose. If both of them are sitting straight up, usually means they're trying to listen. They're trying to get everything I'm saying. If I see the man leaning towards the woman, or both of them leaning towards each other, like these people have a good relationship. They have probably have a better chance at open communication. If I see the man leaning away from the woman, he probably doesn't want to be there, and he definitely doesn't think
Mm,
he has the problem, and he only came because she dragged him, and we're going to have lower compliance. you know so I look at that, and I'll comment on it once I develop rapport with the couple group. But all of those
couple.
things make a huge difference, a measurable difference.
Mm. All right. Thank you so much, Dr. Abiola, for coming on the show. One final question. What message would you like to share with men who may be quietly dealing with infertility? They haven't sought help yet. Maybe they even know that they are struggling with infertility. They know, but they haven't sought medical help. They haven't even probably told their partner. What message would you like to tell them, share with them? Yeah, that's really it.
So I would say male infertility is not condemnation. We're not condemning you.
Mm,
It's a diagnosis, and it has solutions.
mm-hmm,
And 80% of men with proper evaluation, treatment, and timing can improve their infertility. The
mm-hmm,
earlier you start, the more options you have. So fatherhood is possible. Anything is possible. I like to tell my patients. So the longer you wait, the worse for you. And don't
mm.
worry. Usually, what God creates, He also creates a solution at the same time.
Absolutely. That's a really, really nice way to tie a bow at the end of this conversation. Thank you so much, Dr. Biola, for coming for today's free medical
I'll,
consultation and advice.
I'll even go one step further. 10 men that respond, that call me, or visit us on social, will do your sperm analysis for free.
Hi,
So,
thank you so much, Dr. Biola.
oh man, now you really can't be scared, right? So
Yes. And
come
what I've
in,
even
come in.
discovered is that men are listening because remember when we had what conversation was that? Prostate.
Prostate, exactly.
Yeah, and then when you told me that men actually came from the station, I was like, hold on, what?
Oh yeah, yeah, yeah.
So
Good turnout, good
yeah,
turnout.
yeah, yeah. So you
And
can
I
tell
like
that
it. I like to treat the community. Let's give back a little bit.
yes,
So
absolutely, absolutely.
no
So
no
thank you so
problem.
much. You heard from Dr. Fabiola, the first 10 men to go to our specialist hospital. You can call 0913-579-5108 is the number. I'll say it again. 0913-579-5108. That's the number to call, or 0808-886-2635. So run,
Eight
run,
eight.
run,
Sorry,
run.
808. That's the front desk. Zero
That's the
eight
front desk.
zero eight 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 three eights.
Oh, three
Not eight
eight.
eight six. Yeah,
Okay.
888-62635.
Yes. You can, maybe you don't want to text us to ask us. 0808 886 2635.
Sorry,
Let's
eight
say
eight
wrong it.
eight. Yeah, I
88.
think it's wrong. I don't want them
It's
to
the way
call the
I'm
wrong.
saying it.
Just call my number, 0913-579-5108, and I'll direct them. No
Okay, and
problem.
so that's Dr. Abiola's number you're getting. So he will direct you to the appropriate quarters, and you're getting your sperm analysis for free. So you can do you if you want to maintain your privacy, your quietness, then just go. He's been gracious enough to give us his number, and you can reach him as well on social media, ROA Specialist Hospital. and just text them, DM them, and tell them, look, I want to do my free consultation that I got on Women Radio. There is, the avenue to do so. Thank you so much once again for the gifts that you're giving us this morning, Dr. Viola. We truly, truly, truly appreciate you.
Thank you and have a good weekend.
You too. Many thanks to the producer Aisha Sunny and Miriam Kalawale at the studio. Thank you so much, Miriam, for producing me this morning. And to the executive producer, Tomoke Wale Shonaya. Radio Doctor is broadcast Mondays through Fridays. So today is the last edition for this week, but you can join us on Monday for another episode of Radio Doctor at 10 a.m. My name is Fumi Bangala. As we typically say, do have a healthy day. Goodbye. Enjoy your weekend.